We have a lot of rotations of doctors and teams in our facility. The advantage of having this type of monitor on all 3 sites is that you can adapt the configuration according to each medical specialization.
Today in 2023, all phones and tablets have touchscreens. We're all used to playing with touchscreens all the time. It's pretty easy to use. You press somewhere on the screen, you can see the patient's data straight away. The great thing about this device is that you have multiple connectors where you can connect multiple invasive pressure or oxygen saturation monitors. All these ports are universal. This one, for example, is a temperature probe. Just connect it here or anywhere else. The temperature monitoring will be displayed on the screen, whether it's portable or not.
It's the same when any new monitor is connected. The data is displayed instantly. There's no need to go looking for the monitor configuration settings. The cables are stored automatically. After each patient, they're folded and stored. They don't take up any space, don't drag on the floor, and this means they're protected. This practical design makes everything much easier. For example, we can easily access all alarms. For example, I'm just going to click on the blood pressure alarms, and then all the alarms are displayed.
When the monitors were installed, GE Healthcare helped us set up a recovery room user profile, which included the alarms requested by the entire anesthesia team.
We can see right now that there is an ECG signal here in green. When you click on it, you can display all 12 ECG signals.
Instead of having to fetch another piece of equipment and bring it to the room to do the resting ECG, it saves us from having to do the same job twice.
It's like doing an ECG with a resting ECG machine prescribed by the cardiologist. This also allows us to analyze each ECG signal independently. In the event of an anomaly, a screenshot can be taken to document and review the event. When monitoring the 12 signals, different alarms can be set for each signal, whether on the QT parameter or on atrial and ventricular fibrillation.
With these mobile monitors, we save time when transporting the patients to the recovery room.
This is an advantage as patient data are being recorded continuously. This is also a safety feature for the patient.
It can be carried with only 2 fingers.
All you have to do is pull here and place it on the trolley bed.
What's important is that we have continuity of monitoring. As soon as we reconnect it to the bedside monitor, we have the data log. You can press on the trends and retrieve graphical and numerical data of what may have happened previously.
We are able to connect the monitor that comes from the emergency department to this bedside monitor and review all the trends. For example, we can see here when there is desaturation, when there is hypertension, and put things in context. Sometimes we can have places that are a little cramped. Touching can damage the monitor. But with this little button, you can lock the screen and avoid inadvertent mishandling during transport.
Over the last year that we've been using CARESCAPE 1, we haven't had any particular problems, even when dropped. It's robust enough even when falling from a height.
We have to do fairly thorough decontamination in intensive care when each patient leaves the ward. As with the transport monitor, you need just 1 key to lock it and be able to clean it easily.
This makes the daily lives of all the teams working on the 3 sites much easier.